if you want to know how to overcome the fear of having a financial conversation with a cash pay patient, you need to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome, all new listeners, and welcome back to those who have heard my content in the past. Before I go on to this podcast, you know how I like to start. What is new, what is bigger, and what is better in life? I'll share some fun things that are happening right now. I like to work with my kids and see how they grow up in this new age. One of the things that we're struggling with right now, both my wife and I, is making deals with our kids. We've set them up to understand that you have options in life, and you can say yes to certain sports and no to certain sports, but you have to complete everything that we agreed upon. So right now, they are making deals with us to try and reduce how much jujitsu they're doing right now. And when asked, like, what do you not like about it? They can't give me an answer. So it's been a full year of jujitsu. So I think they're wanting to calm down for a while, which I totally get. Yeah. So our deal currently in our household is if you give up physical activity with one sport, you got to make it up with another. So we're looking for another sport, maybe basketball or baseball. Yeah, so they're making deals. What's happening with my wife and I? We just did an amazing date night on Saturday, and it was incredible, incredible customer service, just good overall experience. And I'll bring some of that up in today's podcast. From a fitness standpoint, I still am very hesitant to when I do CrossFit, I am hesitant to pull from the ground like any weight, even like 95 pounds. That fear avoidance is real, absolutely real. I don't want to go backwards. The back is about 72%, but I'm just not forcing anything. In terms of updates on the CG Academy, those who are interested, the Cash PT Clinical Elevation course is now live. Go ahead and go to that at drchrisgarcia.com/elevation. All right, let's get on to this podcast. Why am I doing this podcast? All right. So I love talking to highly motivated physical therapists, cash PT owners, business owners. And I like to know, like, what are you struggling with? Because I'm struggling with things all the time, and I was trying to find solutions. And I was talking to a business owner who is in network, out of network, and they run a hybrid practice. And I said, "What are you struggling with physical therapists?" And they said, I can't get my PTs. My PTs struggle with having a financial conversation, like creating a plan of care or a plan for a person, and they give them a plan of care or a number of sessions or weeks, a prescription for cash pay patients or direct access. And the quotes were, they just won't sell the damn thing. Now, for some people, the word sell or sales is a tough word to understand in healthcare, but ultimately you're in business, and I'm going to solve that challenge right now. I want to share with you whether you're a brand new cash PT business owner, you're an established business owner, and you're struggling with your staff who has a hard time delivering this message to the patient who is asking for it, but it's an internal battle on the staff PT. And for those of you listening out there, you've done this, you've struggled with this, right? You've done clinical rotations or you worked insurance-based care, and it was so much easier to just do your work. And now when you have that same patient coming cash pay, now you feel bad. For some reason, it was so much easier when somebody else was paying for it, but now that they're paying for it, you feel bad. So you either recommend a lower plan of care because you're concerned about their finances, or they've mentioned that, and now you become their financial advisor, and you're like, well, I don't want them to feel bad, so I'm going to go ahead and recommend a lower one just so they don't have to spend enough. And so if you've ever felt bad and you want to know if there's got to be some solutions to overcome this or to tackle this or to make this easier for me, the PT or the patient, that's what I'm going to cover inside this podcast. And it came from a very simple conversation that I think can be easily solved. Now, For those who don't know, I'm a cash PT clinic owner. I have 3 locations. I have a staff of over 15 staff, and I've trained a lot of PTs in cash and in this type of a setting over the last 10 years. And what I'm going to give you today is consolidated from my 10 years of experience and what I mentor my own staff physical therapists on, but also what I help other PT business owners who are startups or they're established and they're looking for a way to make this a little easier because you're really good at your craft. You're good at, doing the clinical work. You have no problem with that. But at the end of that session or of every session, you got to tell them you should come back or you need to come back or here's a recommended number of sessions. That conversation is like people will go through anything else. They rather have go through torture than go through that last statement again. And what they'll often do is you'll find is they'll briefly go over it, they avoid it, or they have a lower recommendation. So I'm going to solve that for you guys today. So at the principal level, let me tell you what the problem is. At the top of it is that patients want a certain outcome, right? That's why they hire you. That's ultimately why they come see a physical therapist. And you have to decide, okay, why did they not go to an in-network physical therapist? Why did they choose to go out of network with cash? There's a reason for that, right? Let's start there. That's one of the main things you have to solve. Why did they choose you versus going in network? Or if were in network in your same clinic, why did they choose to go cash? That's a big question. And why didn't they solve this with YouTube? Why didn't they solve this with another insurance style setting? They're clearly looking for something different. That's the first thing you have to solve. If you don't solve that, you cannot continue with your care because it has to be a different approach. So, at the top level, the patient wants a certain outcome. Now, the business owner, if you're the business owner having this conversation, you actually want them, you have to be able to do this because you're trying to maximize their outcomes, but then at the same time, maximize your income and your profit. Now, there's two things that need to happen. The patient's saying, I want this. Perfect, we can deliver that. And the PT is saying, I can deliver that at this cost. So that's the challenge at the top, but now the communication inside that, conveying that message is the challenge. So the problem becomes is that physical therapists like yourself will have a challenge summarizing this and delivering it in a confident method without sounding salesy, without feeling bad about it yourself. And that's a real struggle. And so I'm going to help you tackle this. I'll give you some phrasing on how to be clear and concise and confident and not feel bad whatsoever. And ultimately, that's why I built this podcast episode, and I'm excited to share it. So here we go. So now knowing where cash patients are coming from and where the PT is struggling, let's talk about this. All right. So you're the cash PT, whether you work for somebody, you're employed, or you're self-employed, or you work in an insurance-based clinic, or you're the business owner and you're trying to teach your staff. All right. There's several scenarios. It really doesn't matter. It's all the same things here. What it comes down to is the PT has an internal challenge. They got into healthcare because they're very empathetic, they're very analytical. This is by and large most PTs, right? People enter a profession because of who they are and what they want to do, and the number one thing they want to do is help people. I get it. Everyone wants to help people. Here's the problem. If you're going to help people, what you've typically grown up in is a PT school mindset or insurance-based mindset where your job is to treat as many customers as possible going through insurance-based. Now, people can disagree on this, but the reason why patients go through insurance because it's the lowest paying cost. It's the path of least resistance. So you were taught to perform a mill-like style treatment because that's what the boards are. That's what PT school treats you. Here's a goniometer, prove to this insurance-based company that you have to justify their care. So you were given a mill-like production style of education, and no one had to make decisions because the insurance model and the physician made that decision. So all you had to do was deliver on the treatment. That made it easy. And that patient, because it's a low barrier to entry, it's a low cost, low copay, that's what they're willing to take a lower performing treatment because it's cheaper cost. That's just what happens, right? That's why you go to a grocery store that's cheaper. You're willing to have lower quality ingredients because it's cheaper. That's okay for your stage of life. But as you start to age, and maybe you're like, well, I want better things for myself. I want better things for my kids. So you start to go to a higher end grocery store that has better ingredients, less processed stuff, a higher caliber of produce, higher caliber of meats. That's just how people go through life. Well, that's how patients go through life. Patients start at a low copay with insurance based. Maybe they realize, I don't like this fruit. I don't like this carrot. I don't like this fruit. I don't like this meat. I want to go up one more level. That's fantastic. But you as a PT have to understand that. Now, what they're doing is they've gone through the lower copay, the lower expectations. Now they're raising their expectations. So now, as a clinician, what do you have to do? It's not about more clinical skills that get you there. It's about, okay, understanding the customer. So the customer has looked, they've gone from Walmart to now going to Target. I want a higher level of service. I want something different, I'm willing to pay more, but they got to deliver on that. Okay, that is what the patient has come in with. Now, the PT is having a little problem here because they haven't understood that. What they're understanding is, well, this person's now paying. I have to deliver more skills because they couldn't get those skills inside insurance-based model. So now my skills have to be so much better, which is absolutely false. Then becomes, okay, well, now I have to, at the end of the session, I have to convey, okay, I've grown my skills, I got them better. And now at the end of the session, I'm like, oh my gosh, I've never had to do this. I was insurance based. Now, whatever the physician or insurance approved, I said you have 12 more visits. I'm used to 12 more visits, 3 more visits. That's what I'm used to. This is where the fumbling happens. They say, well, Mrs. Jones, you, and this is where you start to stutter and you start to talk and you're not confident and your voice wavers all over the place. Yeah, you have tight hamstrings and your hips are stiff and your posture's poor. So we're going to work on your posture to make you feel better. Okay. So here's your 7 exercises. Next time you come in, we'll reassess and see how you're doing. That's a traditional insurance-based approach. Now, when you apply that to a cash-based, that won't work anymore because that person just went through that with insurance. So the question becomes, what's so different and how do you approach that? So at the top level, patients make decisions and you make decisions not on aspirations. People don't want to lose 50 pounds. People don't want to be pain free. Those are aspirations, right? Those are goals. I want to lose 5 pounds. I want to improve my hip mobility, but nobody thinks that. I want to increase my speed by 2 minutes. Okay, people don't make decisions. Those are aspirations, right? I want to be rich one day. I want to do this. Like those are all great, but nothing creates action until people are concerned, fearful, or frustrated. So one is aspiration, I call it pleasure, and the other one is concerns, fears, and frustrations. So one is aspirational, and the other one is concerns. People make decisions off of concerns, right? So for instance, if I said, hey, you're gonna if you hit these marks, you're gonna make $40,000 more next year. Like, oh my gosh, that sounds amazing to me. Now, if I said, okay, great, if you don't, you're gonna lose your job. One of those creates action more than the other. Now, more money sounds amazing, but you're safe. So that's not concerning. But when you're gonna lose your job next year, whoa, now I'm gonna pick it up. So even yourself as a consumer will make your decisions based off fear, frustrations, or concerns. So when you know that, when you deliver a plan of care and you're going to have this conversation with somebody who is considering paying out of pocket, a lot of times you're like, well, maybe they don't have the money. Maybe they don't, maybe I'm not worth it. The reality is the patient's looking for a solution and they sought you out because of who you are and what you could potentially do for them. They're willing to pay. They came in with that mindset. You're like, well, I don't want them to pay a lot, yet you want to make money. Here's the irony of this whole situation. You're like, I deserve more money. Great. Now the patient's willing to pay. You're like, oh, but they're gonna pay. I don't know about that. Let me offer them less. So there's a paradox in this whole situation. If you want to make more money, whether you're employed or you're self-employed, you have to be willing to party. And at some point, this has nothing to do with the patient, has everything to do with you, your internal concerns, your internal fears. And I understand it. I've been through that and I suffered with this for years. And I eventually conquered it with the things I'm going to share today. But I can tell you, here's the scenario that PTs struggle with. They want to make more money and help more people, yet, but the problem is they don't want to do it at a cost, and they don't want that patient to come in twice a week or 4 times a week because they feel bad. There's an irony. I want to make more, but I don't want to offer more and have somebody pay for it because you grew up in the insurance-based model. So that's why I say you're trained in an insurance-based model to produce meal-like production at a lower cost. And those patients were okay with that, but now you're moving from Walmart to Target. How are you going to change your approach? So when we look at this, by and large, now we have the understanding of what the consumer wants. They were concerned and fearful of something happening. That's why they came in. They weren't aspirational. They weren't thinking, oh, finally, this is my chance to lose 5 pounds and feel better about myself. No, what it was I'm frustrated with who I am, concerns, not aspiration. I'm concerned about how I look, how I feel, or maybe I have a wedding in 3 months. And that is what got them there. It's not that their wedding's coming up, it's they don't feel good about themselves. And that's why they're doing it. Now they made a decision to go to the gym and be more active. Well, they weren't more active, so they started going to the Stairmaster, running and doing more squats and all these other things to make themselves look toned and good. If that were the case, now they've added more stress in a short amount of time. Acute to chronic workload ratio is the term. Now they've made a large change in a small time. Now that changes the biomechanics and stress to their legs or whatever it is. Now their back hurts and their knee hurts. So they went to insurance-based care. They couldn't solve their problem. Why? Because they went impairment-based. And it's not that the hamstrings were tight or anything else. It's just that they made a large change in a short period of time. It's all about adjusting their programming plus addressing their impairments. So they seek out-of-network care. Okay, what does it out-of-network care physical therapist do? They 100% look at, oh, well, great. You've actually made a large change in your fitness. This is what we need to adjust. I mean, we do leg days twice a week instead of 3 times a week. We back off of this to address some impairments, get some new shoes, watch your biomechanics. The whole package is great. But then at the end of the session, that cash PT is concerned about that person and they're saving for their wedding. So they don't want to, burden them. So they're like, oh, well, let me just see you once a week for like 4 weeks, right? I feel bad. When in reality, you know that it's going to take you twice a week for 6 weeks minimum to get this person better and possibly a second plan of care. But because of that, you feel bad. So when you start to look at why this person needs your care, rather than focus on the impairments, I'm gonna give you some easy options here to be able to feel good and confident about doing this, because if you don't feel good, there's no way you feel confident. And you have to see it differently in order to know that what you're doing is for the right reason. So this person has a wedding and they want to feel good about themselves. You're delivering on improving their confidence so they can enjoy their wedding. What you're not delivering on is I'm improving their hamstring length so they can, do whatever in the gym. I'm not fixing their programming so I can reduce the knee pain and they can be happy. That's not what you're doing. You're all about what they're concerned or frustrated or fearful of. You focus on that. You do not focus on the impairment. Get away from the insurance-based model. This is how PT school taught you. This is how the insurance-based model taught you. Get away from that. You have to understand the customer. What are they concerned about? What's the thing that brought them into your clinic to see you? It's probably the concern, the fear. So you got to figure that out. And if you can't, that's where the problem lies. It's not in the phrasing in the financial conversation. It's understanding what their concerns, fears, or frustrations are. Once you understand that, that is what you focus on in your plan of care design. And this is genuine because you have to understand the customer. So, for instance, when you provide a plan of care, or talk about finances, when you're like, hey, I need you to come in 4 times a week or whatever your thing is, instead of saying, I need you to see 1 time a week for 8 weeks, and that's what you say, the first step you're going to do is provide 2 to 3 options for them to come see you. Hi, Mrs. Jones. I understand that you are preparing for your wedding in 3 months and you have knee pain and back pain from all the exercise you've been doing. As we've discussed in this session and from what I've seen in your impairments, I'm recommending that you come in 2 times a week for 6 weeks just to start you off. Now, that would be a better situation. If you're saying, hey, I want to uh, have the best chance possible to be in that wedding without any pain whatsoever and you help you lose weight throughout this entire process, we're going to have to be a little bit more aggressive. So I'd recommend 3 times a week during those 6 weeks. Now, if you're saying, Chris, I can do a lot of it on my own and I'm willing to do this on the gym and I only need you 1 time a week, perfect. At the bare minimum, I won't let you go any shorter or fewer than 1 time a week for the next 6 weeks. So now, it really depends on how you want to attack this wedding. Do you need more support from me? And I can help you attack this at a faster rate with 3 times a week. 2 times a week would be just in that sweet spot if you are not overly concerned. And if you're saying, hey, I'm very independent, I can do 1 time a week, that would be fantastic. That's perfect. Now you have 3 different options: good, better, and best. Which one out of all those, Miss Jones, would you prefer? Which one are you considering? That allows that person to make a judgment and a choice and be a participant in their care. Now, a lot of times physical therapists don't think about providing options, so they provide one. And that's why they're fearful. They're like, you provide the lowest one possible because you're fearful of them judging you, or you're fearful that they won't be able to afford you. So step number one is, instead of providing one thing, you provide 3 options. This simplifies the process and it feels good. Now you takes the pressure off of your shoulders and you don't have to think, wow, I didn't give the lowest. I gave them an option to do the lowest, but I also gave them the option to do the highest and they can choose. Now, even if they didn't have all the money in the world, if they were willing to do it in this short term because it's their wedding, it's a once in a lifetime thing, you never know what the motivation of that client is, but you have to be able to do that. So, step number one to overcome this fear is remove the fear by placing the choice and judgment on them by giving them options versus one thing. It's the number one thing that you can do. The second point of this whole thing is to do it concisely. I see physical therapists when they offer these plans of care and you're recommending, hey, what should I do? It gets very complicated. They make it super complicated. They'll say, well, Mrs. Jones, let's see you 2 to 3 times a week for the next 6 to 8 weeks. And after that, we're going to do 1 time a week for the next 4 weeks. And after that, we'll go to every other week. That person is so lost because you went from phase one to phase two to phase three. And that person's like, wait, what are we doing? It wasn't clear and concise. Focus on this first phase. That's rule number one. And you have to say it so clear that there's not another option. If you want to do this at a steady rate and you feel that you can do this on your own, let's do 2 times a week for 6 weeks. That's it. That's it. Do not do 2 to 3, 6 to 10, 12 to 14, 18 to 20, this, then this, then this. It's too much. The first phase is 2 times a week for 6 weeks. Then here's where the fear, concern, and frustrations come about. If the fear and frustration is that they won't be ready for the wedding, right? That maybe that's what they held on to. The aspiration was look good in the wedding. No, 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 no. People make decisions off their frustrations and fears and concerns. So you're going to finish out your statement with reminding them that you know what they're concerned about and this is why they're here. Ms. Jones, to help you with this, and you feel like you can do this at a steady rate, we're going to do this for twice a week for the next 6 weeks so that you are feeling good in your wedding dress and not concerned about not fitting in it or looking as good as you wanted to. That's why you came in here. They made a choice to come see you because they were concerned they weren't going to fit in their wedding dress and lose the weight that they wanted. You're here to help guide them through the process, not so they can fit good in their wedding dress, so that they're not concerned that they won't fit in their wedding dress. It's one small thing, but people make decisions. Remember this. I'm going to give you $40,000 raise, or you're going to lose your job. Which one are you concerned more about? Losing my job. You make decisions based off of your concerns and frustrations and fears. So does a consumer, but you don't realize this because you think everyone is aspirational. So the first one is to provide options. Number two was to provide a concise statement ending with their concerns, fears, frustrations, because that's why they make decisions and you're reminding them of that. And the great part is you're doing this after every session to remind people why they want to come back to you. This is how people make decisions. The third one is once you've provided options, you've provided a clear, concise statement followed by their fears, frustrations, you have to allow silence. Silence allows people to process information. And if you continue rambling, they can't understand what you just said and process what they want to do. So, this is the common thing that I see a lot of cash based PTs do or insurance based PTs who see a cash patient is that they say, we're only going to provide one option. Miss Jones, I'll see you one time a week, every other week for 12 weeks, right? So, because they don't want to have them pay a lot. And then they don't make it concise. Yeah, we're going to start with one time a week for every other week for 12 weeks. And then we're going to move you to once a month for 12 weeks. And then you're going to do these 7 exercises 3 times a day, every other day. That's what we're going to do. And we're going to see you next week and we'll reassess everything. And that person's like so confused and they just keep talking. Why? Because they feel bad about offering a service for a fee. Now, what you need to do is pause after you make your statements or your recommendations to allow the consumer, the patient, to process information. This is how we all process information. So you're going to provide options, good, better, best. Then you're going to provide it with a concise statement ending with their fear frustrations. Great, we're going to see you twice a week for the next 6 weeks. So that way you're not concerned about fitting in your wedding dress in 3 months. Which option are you considering? Silence. Allow them to marinate on that. And you think that silence is awkward, but silence is golden to be able to help this person make that decision clearly. Silence is what allows them to process everything you just said. Just shut up. So, the crazy part about this whole thing is that for some of you, this is, wow, I've never thought or considered this. And some of you think, well, I don't know if I really need to do this. If you work insurance and you see cash patients, you need to do this. If you work solely in cash, you need to do this. Why? Because the consumer has then made a choice to come see you. The other one hasn't because they're not paying directly for every single session. It's a difference in expectation and the skill set involved. And if you don't understand that, you will continue to fail with an empty schedule and people leaving you on average 2 to 3 visits into their plan of care. That's how I can tell a clinician is not very good at cash PT is because they have a normal visit average rate of 2 to 3 visits. And then we'd be like, well, I got them out of pain. You didn't solve their problem because their wedding is in 3 months. Really, you got them pain free in 3 weeks and they're not going to fall off and they don't need more help with their programming. They don't need help in the gym with their biomechanics and everything else. You think it's magically not going to come back. A person didn't go to school at the same length of you to understand fitness, to understand health and biomechanics and how to progress over the next 3 months so it doesn't come back. They don't understand that. So you can't tell me they're pain free in 2 to 3 visits. You didn't solve their main problem and you did them the disservice. So the difference becomes here is in an insurance-based model, a lot of times you are maybe you work for a hospital, maybe you work for, I don't know, another type of setting, and that's a non-for-profit setting. Now, when you work in a for-profit setting, you have to understand that whether you like it or not, if you're a staff physical therapist, you will work for a profit. You need to in order to have sustainability in your position, you have to work for a profit. If you're a business owner, 100%, you're going to close the doors if you don't make a profit. So you have this patient who wants to come see you and you need to make a profit, but you're scared to make a profit because that's where your barrier is. I don't want to recommend it to them. So remove that emotion and that feeling of stress from yourself by providing the options, 2 to 3 options, provide it in a clear, concise statement, followed by their concerns and fears, and then allow silence. Those 3 tips will put you in a good position to feel good about it because you no longer have to stress. It's not your burden, it's their burden to make that decision. And you need to allow them to do that. Now, once you get this all down, and you are, absolutely crushing it, you will come into people who process differently. They are different personalities. We'll get into those into other podcasts, but ultimately, this is the starting point for you. If you're a cash-based PT, this is going to help you tremendously. If you're an in-network, out-of-network staff PT, this is going to help you. If you're a business owner with multiple PTs underneath you, you need to teach them this, because if you don't, your numbers will never change. Your profit won't change. Your salary won't change. Nothing will change. And that you have to understand that this is a different person with different expectations, and it requires a different skill set, not just clinical skills. That worked in insurance, but will never work in cash. I've been doing this 10 years. For those of you who know, I have 10 years experience working in a cash pay clinic. I'm only cash. I've grown up in this. I've taught this. I've done this mentored for over 10 years. And I'm telling you right now, if you don't figure this out, you'll always be in this hamster wheel of 2 to 3 visits, 2 to 3 visits. You're always looking for more patients. Does that sound familiar? I'm looking for more patients, more patients, more patients. No, there's people who want to stay and see you. How about you get better at delivering better service and understanding their wants and needs? And that's typically how you fix this. So there you have it. For those of you who are wanting to learn more and you're thinking, well, there's got to be more than this to Cash PT, and I really want to have a startup. I really want to thrive in my business and grow my business. For those of you who are interested, I am hosting a Cash PT clinical elevation course where I help business owners, aspiring business owners, new business owners, establish with PTs within it too, basically to help you understand the customer, get you to a point where your cash PT or cash pay patients, it's a no-brainer to come see you. You feel confident about your skill set, learning the skill set of cash PT, but then also understanding how this consumer is a little different than your insurance-based care. So I'm here to help your business grow, to help treat cash pay patients, grow your practice, and ultimately become the go-to expert inside your town, which is what you want, and feel good about it. So there you have it. If you guys are interested, it is an 8-week online mentorship course. You can go to the website at drchrisgarcia.com/elevation. And I'm excited to see you in the course. If not, I will see you guys on the next episode. Take care.